So if you have or recently had COVID-19 and you're wondering how to get back into running, you're going to learn exactly that in this video, where I'm going to go through some expert and clinician developed and backed guidelines for a return to play protocol, so you return to running without any guesswork in the safest and most sustainable way possible. I'm going to start with a quote from Epictetus, who said, "We cannot choose our external circumstances, but we can choose how we respond to them." And that's the entire theme of this video that you must learn. You control your response to events. So let's talk about how to make that response a smart one. And I know that you may feel a sense of hopelessness in that you're going to lose all the training you've done and your fitness will be totally gone for the rest of this season. But I promise you that this is not the case if you give your body the time and the opportunity to recover and safely return back to running. When faced with an injury or illness, the best option is almost always to simply let that time go that you would have spent training. It's gone, it's past. I know that what's easy to say is often hard to do, but for example, when I was training for the Boston Marathon, I had a little calf niggle pop up and I was out of proper training for a few weeks. However, I rested, I eased back into running, and I don't believe my goals or the outcome was any different with or without that modified training build up towards the marathon. And with your training post-COVID, you can get back into it. You just need to be mindful and smart about it. There's currently not a ton of evidence-based guidelines when it comes to making a decision on return to play for athletics. But when it comes to COVID-19, there are a number of experts, agencies, and authorities who have some great recommendations when it comes to this subject, and we're gonna go through those right now. Obviously, you must refrain from exercise during the acute illness phase. First of all, never, absolutely ever do any sort of training with a fever. Your period of rest certainly depends upon many individual factors, including the severity of the illness and the presence or lack of any cardiopulmonary symptoms. But once you're past these symptoms, if you feel good to go, then you're probably good to start easing back into this return to play protocol. Again, the hard rule is that you must be symptom-free before returning to any sort of training. So next, let's go through a 5-stage return to play protocol, and I'm gonna lay it out for you exactly so you know exactly what you need to know and how you should progress. The recommended stages of return to play to full sport participation are: number 1, rest and recovery. Number 2 is light activity, moderate activity, intense activity, and then normal training / full play. I'll go over exactly what these stages are in just a second. Keep in mind that between organizations, there's of course no clear consensus about the appropriate duration of each stage. And I'm not a doctor, and you probably aren't either, but please exercise good and clear judgment in cases like this. Now, the experts at UpToDate, an evidence-based clinical decision support resource, recommends at least 2 days per stage, and it gives a couple examples. So for example, an otherwise healthy under 25-year-old who experienced only mild symptoms may be fine with 1 day per stage. However, athletes over 40 who maybe had significant comorbidities such as type 1 diabetes, recovering from more severe illness such as an intensive care unit administration, or maybe they're returning to more demanding activities like marathon training, may require upwards of a couple weeks per stage. The experts are quite clear that the pace at which an athlete should progress stage by stage will vary widely, and I would think that if prior to COVID you were in good health and not of any sort of high risk, once your symptoms subside, and assuming they do not return during your reverse taper from rest to training, 1 to 2 days per stage should be fine. That's what I did, but use your best judgment, of course. I tell my runners that when making these types of decisions for themselves, ask yourself, if you were your coach, what would you tell yourself to do? It would behoove you to regress a stage if excessive fatigue or other symptoms should reappear, be prolonged, or be concerning. Returning to the progression or the next stage should wait or hold off at least a day or two of rest without symptoms before returning to that next step. So let's go over exactly what the different stages are and may look like for you as a runner. And stage 1 is the initial rest phase, and the objective is to simply allow for time for recovery, and that includes activities of daily living, such as preparing meals and doing laundry. That's the extent of stage 1. Stage 2 is light activity with a gradual increase in heart rate, staying in the easy zone of under about 70% of max heart rate, and keeping the duration of exercise under 15 minutes. Exercise examples include light jogging, and my go-to, which is exactly what I did for my first kind of run workout after COVID, 10 by 1 minute jog, 1 minute walk with some walking before and afterwards as well. Please keep in mind that you may feel you are ready to go to get back at it, but you don't really know until you actually do get back at it. So start easier, start lighter than you otherwise think you should. If you can accomplish this and feel totally cool, totally good to go the next morning, you're probably clear to move on to stage 2. However, staying in stage 1, that run walk, that gradually extending of the running sections for a day or two might not be a bad idea, but that's your call. Stage 3 is moderate activity, and the goal is to simply increase your exercise frequency and duration. You can up your running intensity to a little bit around 80% of your max heart rate for 30 to 45 minutes. And examples of this are simply go for a 30 or 45 minute easy jog. Now, this is when you may begin resistance training as well. And honestly, this could be many people's normal training routine, and you could stay here for a full week. After my initial run walk, I did a 6 mile, so about an hour run with a little bit of walking thrown in and some strength work. Stage 4 is advanced activity with an increase in exercise intensity and the restoration of functional skills with upwards of an hour of training. They recommend that you ease into some more intense aerobic activities at a moderate but not fast pace. So you're still holding back, but you can maybe sprinkle in some strides, some brisk accelerations. Also feel free to get back into doing some more intense resistance training, such as full body exercises and weights. And again, this is pretty decent running, and you could probably stick here for a week or two. This is pretty kind of standard, go and run easy, do some strides, do some strength work. So again, if everything has gone really well through COVID and upon the cessation of your symptoms, you could go for that first 10 by 1 minute jog, 1 minute walk to maybe a fairly normal training week within a couple weeks, as long as you remain symptom free. And if you like that Stoic quote from Epictetus that I mentioned earlier on, and you want more great Stoic quotes and running talk, check out this video right here.